Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Right, so today we are going to talk about Hashimoto's progression. And I'm Dr. Rutherford, for those of you who've never seen me before. And we're talking about Hashimoto's, big series here on Hashimoto's, and we're going to talk about progression today. Hashimoto's progresses would be like the Cliff Notes form of what needs to be said here. So basically, look, autoimmune problems always progress. For different people, they progress differently. And that goes for symptoms, and that goes for speed of progression. And so the bottom line is all of these autoimmune problems progress. Hashimoto specifically, we've talked about this for those of you who watch us all the time, and I'm shocked at how many of you that are out there that watch these things all the time. But it starts off as silent autoimmunity. So Hashimoto's, basically you have the DNA to be able to develop an autoimmune problem, and your DNA kind of alerts the immune system that it's okay to attack your thyroid. And it may be that you live a pretty healthy lifestyle. Maybe you just have a strong constitution. For some reason, you have a stronger stronger immune system than other people. And then, but you're actually making antibodies to your thyroid, and you don't even know it. You don't have any symptoms. You don't know anything about it. So for some reason, somebody might accidentally run the antibody and say, you got Hashimoto's, and you would go, I don't have Hashimoto's. I don't have any symptoms. I'm fine. I'm not losing my hair. My weight's fine. I'm not fatigued. That's silent autoimmunity. And then the progression from there is, frankly, life. Okay, lifestyle, sleeping poorly, not getting enough exercise, getting too much exercise, eating improperly, getting a lot of chemical toxins in you. Here in Reno now, we had this big smoke, issue from all the fires in California for months. And there's a lot of toxins in there. I saw my patients get worse from burning tires and burning houses and burning cars and burning furniture and all the chemicals with that. All of these things attack. Stress attacks. Viruses attack. You get a pneumonia. All these things keep flaring up immune responses. And to the degree that that person's physiology is weak, medium, or strong, you keep getting attacked, and then the next thing you know, you start getting symptoms. The silent autoimmunity person, 999 times out of 1,000, does not know that they have it. So what starts happening is you start getting Hashimoto symptoms. You'll start getting hypothyroid symptoms, and then you'll start getting tired and fatigued, and your hair might start falling out, and you might start getting constipation. You might not put it all together, and then you go to the doctor and they test you. Maybe they run the antibodies and they're normal. Maybe they run the antibodies and or maybe they don't run the antibodies, which is more common. And so you have all these symptoms, but there's no testing. You don't have enough damage to your tissues yet for it to show up. So the tests are normal. You're feeling like crap. You have what we call reactive hypoglycemia. We can talk about that too. Reactive Hashimoto's at that point in time. And then it advances as life goes on. Get it? Life. So genetics, lifestyle, over a period of time, tissue damage, that's how it goes. And until you change that lifestyle or you find out what you need to do to dampen it, and then the next thing you know, now you're full blown, your thyroid's tender and nothing's working. They found out that you got hypothyroidism. They're giving you the drugs. It's not working. And so now you go to the doctor, they test you for Hashimoto's, and now you're full-blown official Hashimoto's because you have enough damage to the thyroid sites, the cells in your thyroid, to show up, and your antibodies are flying off the charts maybe, and now they go, oh, you have Hashimoto's, and then they give you a medication for it. So that's that's like the clinical progression of it, but in the end, it just progresses. Let's say now you're full-blown Hashimoto's. They know that your antibodies are like 12,000, and the doctor is trying to figure out your thyroid medication, and they take it, and it's up and it's down, or it keeps getting more as the years go on. And if your TSH, if your thyroid stimulating hormone number keeps needing your doctor to increase your thyroid hormone over a period of years, you have an unstable Hashimoto's, which means that you're getting consistent damage to that thyroid. That's the progression of it. Now, the progression might be that the person's not changing their thyroid over that period of time. So the progression for them is slow, but they might be getting tissue damage to other areas because you rarely ever get one autoimmune problem. So if you have Hashimoto's, it's not uncommon for you to develop autoimmune gastritis, autoimmune hepatitis, polycystic ovarian syndrome, celiac disease, antibodies against your cerebellum, all of these things. Every time you keep getting flared up, now that you've had one attack, you can start getting other attacks. That's the progression. It's somewhere, you're somewhere in there, and that progression may be severe, it may be moderate as far as symptoms go, but it always progresses until you figure out what are the triggers, how do you pull those triggers, how do you stop them, how do you change the lifestyle, are you over-exercising, are you sleeping right, are you in a crappy relationship that you've been in for 20 years that's killing you. These are all things that you need to figure out because you need to start living a healthy lifestyle. And for an autoimmune patient, it's a little bit more than even that. And it's not just living a healthy lifestyle, but you have to then you have to drive the car according to the rules of the road relative to Hashimoto's, which is many of the things that we've talked about in this series. So that's progression of Hashimoto's. It always progresses. Our goal when we're treating a patient is to stop first thing our goal is to stop the progression. And then once we accomplish that, then the goal is to start pulling on the string of where you start, what systems are the big problems, these are triggers, which are the biggest triggers, pull them, see how much better a person gets, pull the next one, see how much better the person gets. So the goal is to stop the progression and reverse it to the degree possible based on that patient's history, tissue damage, ability to reverse. That's Hashimoto's in a nutshell. That's autoimmunity in a nutshell. That's the progression of an autoimmune patient.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.